common question we hear in the office is, can I stay active while I'm in pain? Let's chat through some of the considerations on how to approach that most effectively. Hi, I'm Dr. Zach Ratliff from TruMotion Therapy, where we specialize in the conservative management of musculoskeletal injuries and pain. The short answer is yes. In many cases, we can remain active while working through pain and injuries. The important thing to note is we want to make sure that we're not aggravating our pain or making it worse through activity, but we also don't want to go so far the other direction where we become fear avoidant of certain activities. The reason that we want to maintain this level of activity is because we know movement has such a big impact on physical and mental well-being. So the more movement that we can maintain while not aggravating our current symptoms is going to be our best case scenario. Key things we want to think through as we're approaching activity while working through pain, injury, is what can we do to avoid increasing that pain? So initially, we might be able to maintain doing the same activity, whether that's running, weightlifting, CrossFit, anything of the like. We want to maintain that actual activity. So maybe we modify the frequency that you're doing it. Maybe we modify the duration of how long you're doing it. Or maybe we avoid certain movements or certain tempo or speed workouts in your runs. If we can maintain the actual movement, that's kind of best case scenario. If that's not able to be done, maybe then we consider modifications of that movement. So in the case of running, to preserve the cardiovascular fitness that we've built up, maybe we modify to do some stationary bike or some rowing or some swimming, another form of cardio that allows us to maintain as much as we can cardiovascular wise, while allowing the tendons and joints to kind of help recover in the meantime with a little bit less stress on them. Put another way, let's take the weightlifter or CrossFit athlete. If barbell squatting or barbell movements are aggravating that pain, maybe we can modify to a dumbbell variant or a kettlebell variant of the same movement. So we're preserving the stimulus of that workout, but we're taking out the stress that maybe the barbell is putting on that particular case. Obviously, working through pain can be a nuanced issue. It is one that not all pain is indicative of harm to the body, but in certain cases, working with a provider that is familiar with pain, with sports injuries, can be helpful for navigating your return to activity or making sure that you're doing that in the most effective way so that these injuries don't kind of become cyclical in nature, popping up every couple months. So if you'd like to see more information or access more resources, I would encourage you to check out our website at TruMotionTherapy.com for more information, as well as the ability to schedule an appointment, and we would love to help you through returning to your full activity.